Okay, so we're here today with Christina. She's a patient here in our office, and we've been seeing her for about, I think 8 months or so, around there. She initially came here with headaches, neck pain, and then some popping, pain in the jaw. I don't remember everything, but were the headaches coming from the jaw too, or a combination of the neck and the jaw?
Definitely a combination of the neck and the jaw, because I think as we've gone through things, I've found them to be really tied together. But primarily it was really painful just to extend the jaw more than just kind of that much. It was like anything longer than that, I could feel the pulling and pain, especially if like long chewing of, you know, like things like steak or other meats and things like that. And then yawning, you know, that would be a lot sometimes too, and really uncomfortable. So I'd have to kind of like brace it and try to use a lot of heat and kind of self-massage. Was getting kind of minimal results with that. So definitely after about a month or two of not a lot of improvement, I figured I had to kind of do something about it to get relief from that.
And is it feeling better at this point?
Yeah, and so again, about 9 months out now, I can open, like full open jaw, hold it, move it, chew long extended periods of time. Don't have the pulling sensation or the pain, no clicking, popping, or anything like that. So it's been just really great to be able to do all that kind of normally again and not have to kind of worry and be aware of how am I chewing and where's the positioning of my jaw when I just do kind of everyday activities like yawning and chewing and sometimes
great.
talking.
So I'm just going to demonstrate today some of the treatments that we've been doing on Christina. First is addressing the area in the spine between the occiput and the upper cervical spine. So there's a lot of muscles back here that run up and attach to the base of our skull, right behind the TMJ joint. And we want to focus on getting some mobility back here, getting some of the muscle spasms, compression back around the back of the head and the top of the cervical spine to be mobilized and less compressed. So the first procedure we're going to do on Christina is the Y-strap adjustment. We're going to put the Y-strap back behind the back of her head, pull up gently. Well, it's not so gentle. Lift up, and we're going to release the occiput from the atlas and get some mobility restored between the atlantal occipital region. Okay, so first I'll have you lay here on your back, face up. Slide down. Okay, good. And from there, I'm just going to have you hold yourself in. Hold down as I pull up. Now let's slide on up. Now we're going to adjust her jaw and neck. So come in here, just like this.
That's a good one.
All right. Okay, so now I'm going to demonstrate some of the myofascial release work that we've been doing on her jaw. So we're going to spray some magnesium biofreeze on her muscles around her neck. All right, let's see. Can you turn your head to the right, please? Thank you. Good. So let's check and see how it's doing today. Give me a big ah, open, then close, then open, close. Okay. So now I'm gonna go inside the mouth. We're gonna do myofascial release on the muscles of mastication, the temporalis muscle around the forehead here, and then some of her cervical flexors in the front of her neck that get a little tight. You can kind of see here, if she turns, how this muscle here kind of sticks out. These are the muscles that get tight when we're at the computer a lot, flexing forward. All right, so we'll open. So we're going to come in. Let's see if we can get right on the masseter pterygoid muscles. And we're just going to kind of gently strip and massage these muscles from the inside and out. And then I'm gonna have her just slowly open and close your mouth. Good. We're gonna do that several times. Okay. And then what I like to do now is have you lightly clench your jaw. We don't want to squeeze too hard. Just lightly contract those muscles of mastication. And I'm going to come in and just massage here. And then we're going to slowly open and close. Do that several times. So what we want to do is get those muscles while they're moving, like we would do in real life. We want to kind of massage and release, just like you were chewing or opening your mouth to talk. And then again, I'm gonna have her lightly clench. Lightly clench. Good. So we can kind of retrain these muscles for people that grind their teeth at night. Some people just hold tension in their jaw. I'm massaging inside and then on the outside here also. And then one more time, big ah, good. We'll just do that 2 more times. Big ah. Okay, that's good there. Now I'm gonna come in and see if we can get some of the muscles that get a little tight when we're sitting at the computer too often or stressed out. These muscles kind of run up, attached right here by the jaw. You can kind of see here from the clavicle right up to here. If they get too tight, it can be like a tight rope. You can cause the tracking of the jaw to deviate when you open and close and lead to TMJD. So I'm just gonna first slowly open and close. We come in here, good. That's my great. Just a little hungry. There you go. How's that feeling, Christina?
Pretty good.
Okay. Now I'm going to come in and we're going to adjust her upper thoracic spine. So as we kind of slouch forward at the computer, the muscles on the neck contract. As those muscles contract, the leader right up to the jaw, that can pull our jaw out of alignment and lead to temporomandibular joint dysfunction disorder. All right, so we'll slide down just a little bit here. Okay, perfect. Across here. Good. All right, let's come on up. How did that feel?
Pretty good. I could feel when you first did the first adjustment, that tightness I had been explaining was pretty.
Did you have any discomfort during any of the treatment?
No. Again, it just it was feeling tight, and then I don't know if you heard the top pop, but it went, and then it was
the jaw popped. Yeah.
And it was relief. With what we've been doing with the internal massage, it's no longer has kind of that tension feeling I had been feeling. I know we got with external work, we got almost most of it, 80% of it, and then when you started with the internal portion, that really fixed that little bit of catching that I would still feel, kind of opening fully wide like that, and it would kind of feel like it catches, or kind of like it was moving over something, the muscle in the jaw, and I would stretch. So with those combinations of everything and kind of the tension here, I've definitely noticed a lot less jaw issues. Even now, with some of the tension that I'll find myself getting in my neck, it no longer is aggravating my jaw as much or causing kind of the tightness at the base of my skull that would lead to tension headaches and things like that.
Right. Yeah, most patients at first it is a little uncomfortable. I'm sure the first couple times it was a little tender in there, and you probably had a little soreness for a day or two afterwards, but that tends to get better. And typically what we see is the pain isn't as often, the headaches that come with TMJD get better, and most of the times the popping when you open and close improves as well. So there you have it. If you have any questions, please get in touch with us.